Hello, this is Jennifer Salazar with the Better Business Bureau Education Foundation out of beautiful Houston, Texas. The BBB Education Foundation Scam of the Week for May 11th, 2020 is telehealth scams and Medicare coverage during COVID-19. Let's review a definition of telehealth. Per Wikipedia, telehealth is the distribution of health-related services and information via electronic information and telecommunication technologies. It allows long-distance patient and clinical contact, care, advice, reminders, education, intervention, monitoring, and remote admissions. Let's also review Medicare coverage during the coronavirus. Medicare Part B, which is your medical insurance, covers COVID-19 tests when ordered by your doctor or healthcare provider on or after February 4th, 2020. Also, Medicare covers all medically necessary hospitalizations, including extra days in the hospital for patients who had to stay longer under COVID-19 quarantine. It's very important to know that there is no vaccine for COVID-19 at this time. However, if one ever becomes available, Medicare will cover it. Medicare also recently expanded coverage of telehealth services to enable beneficiaries to access a wider range of services from their provider without having to travel to a facility. This includes access to doctors, nurse practitioners, clinical psychologists, and licensed clinical social workers. During this emergency, there are also more options for the ways your provider can talk with you under this provision. Unfortunately, scammers are taking this opportunity of this world pandemic. They're reading the headlines and they're studying the rules of Medicare to come up with new ways to scam you. Let's review those scams so you know how to stay safe. Did you know that a Medicare number is worth at least $30,000, but not to you, to a scammer? Also, last year, 60 billion, billion with a B, was lost in Medicare fraud, error, and abuse. Unfortunately, scammers are taking this opportunity of COVID-19, a world pandemic, and coming up with new Medicare scams. For example, providers are initiating calls to patients to do a check-in only with no exam. Then the provider is billing for the exam. So what does this mean? So providers are calling patients out of the blue with no appointment that was scheduled, and they're basically checking on them. Then they're billing Medicare for that check-in. They're billing it under an exam. Also, services not provided. The appointment never took place. You are reviewing your Medicare summary notices, and you notice some appointments on there from your provider, but they never took place. Also, be on the lookout for senior care packages. If you receive a phone call offering you a senior care package because you're on Medicare, it is definitely a scam. These senior care packages include hand wipes, sanitizers, gloves, masks. It is all a scam. You are not entitled to a free senior care package because you're on Medicare. Scammers will do anything they can to get your Medicare number. Again, that Medicare number is worth more than a credit card. It's worth $30,000. So today I want to teach you how to protect, detect, and report any telehealth scams or Medicare scams. I want to give you the tools to protect yourself against these scams. Step 1, protect. Do. Call your doctor or provider to schedule your telehealth appointment. Treat your Medicare card like a credit card. Know that Medicare won't call or visit to sell you anything. You'll get a call from the Queen of England before you get a call from Medicare because it's not going to happen. Even if your caller ID says 1-800-Medicare, they spoofed your caller ID, which means they changed the phone number in your caller ID. Yes, scammers have the technology to change the phone number in your caller ID. Hang up if you receive a call from someone offering you a free test, treatment, or supplies. Watch out for identity theft. Check your bank statements, check your credit card statements, review your Medicare summary notices. If something doesn't look right, report it. Pass it on. pass all this information on because you could be a scam stomper and stop a scam before it happens. Don't give out your Medicare number except to your doctor or your Medicare provider. Also, do not carry your Medicare card with you unless you need it. A lot of folks have asked me in the past, but Jennifer, what if I'm in a wreck and I need to go to the hospital? The hospital, the doctors can bill Medicare later. Please don't carry your card. The Texas Senior Medicare Patrol hotline gets at least 5 calls a week with people that lost their Medicare card or it was stolen. Step 2, detect. Review your Medicare summary notices and other statements for number 1, services you did not receive. Number 2, double billing. And number 3, services not ordered by your doctor. And also, did you know that you could review your Medicare summary notices online at www.mymedicare.gov? You no longer have to wait for your Medicare summary notices to come in the mail. You also should use a personal health care journal. You can use a notebook or you can contact us at the Texas Senior Medicare Patrol for a healthcare journal. The way you would use your healthcare journal is you would write down the appointments and you would also write down when the appointments occurred. For example, you went for a wellness check. You would write the date in there and you would write your doctor's name and then you would write what happened, like the wellness check. Then you would use that information and compare it to your Medicare summary notice. If something doesn't look right, you would report it. Step 3, report. If something doesn't look right and you feel comfortable talking to your provider, we highly recommend you contact the provider to fix the error. It's important to gather your information and documentation. But please remember, you can always contact the Texas Senior Medicare Patrol. It is free and confidential. Our telephone number is 1-888-341-6187. The Better Business Bureau Education Foundation in Houston, Texas has the Senior Medicare Patrol grant for the whole state of Texas. We cover all 254 counties. The TXSMP is ready to provide you with the information you need to protect yourself from Medicare fraud, error, and abuse. Detect potential fraud, error, and abuse, and report your concerns. The Senior Medicare Patrol and their trained volunteers help educate and empower Medicare beneficiaries in the fight against health care fraud. Your Senior Medicare Patrol can help with your questions, concerns, or complaints about potential fraud and abuse issues. It also can provide information and educational presentations. Also, we can provide WebExes and Zoom calls if needed. Texas Senior Medicare Patrol hotline is 1-888-341-6187. Thank you all so much for joining us for this week's Scam of the Week. Again, my name is Jennifer Salazar, Program Director with the Texas Senior Medicare Patrol and the Better Business Bureau Education Foundation. Please call us if you ever need our assistance. Again, the Texas Senior Medicare Patrol hotline is 888-341-6187. My direct phone number is 713-341-6184. And you can always email me at jsalazar@bbbhou.org. Be a scam stomper. Pass this information on. Thank you and have a great day.